Hello to the management of Jpts. The person whom you're seeing or viewing is Adenekon Blessing Opeyemi, a 200 level student of Jpts. I'm healthcare management nothing department. I'm also attending Abeokuta Center in Ogun State. So I'm here to talk on the effect of doctor-nurse relationship on patient care. Doctor-nurse relationship. Doctors and nurse need to work in together. Doctors and work need to work in collaboration. Doctors and nurse need to work in unity. Doctors and nurse must have a good communication skill to meet the common goal of every patient. And the doctors and nurse relationship have a long way to go on a patient. That is why doctors and nurses, there shouldn't be any conflict, there shouldn't be any disagreement between doctors and nurses, because it could have a negative effect on the patient, and which is very very wrong and which is not good. The effective doctor nurse relationship is imperative to the well-being of the patient. Is imperative, is very vital and important. That is why doctors and nurses must work in harmony and they must be in together. There are six principles that guide a quality relationship between doctors and nurses. These principles, if doctors and nurses hold on to this principle, they won't have conflicts with one another. They will be in unity and harmony. One is respect, two is genuineness, empathy, active listening, confidentiality and trust. For easy comprehension of what this study is all about, we're going to look into the definition of various concepts like effects. Effects in this study could mean the end result of doctor's relationship on a patient. Effects does not only mean negative, it could also mean positive. The positive and negative end result of the doctor's patient relationship. And who is a doctor? A doctor is a medical practitioner who is skillful in healing or treating patients and has been licensed to practice in profession, e.g., the dentist, the physician, and whatsoever. And then, who is a nurse? A nurse per se is a person who has undergone a stipulated period of training and has been authorized by the Nursing and Midwifery Council to practice nursing. And who is a patient? A patient is a person who is sick and is under the care of the healthcare facility or is under the care of a physician. And what is a doctor-nurse relationship? That is what we are looking deeply today. Refers to how nurses and doctors interact and communicate with patients during provision of healthcare services. Not only do we have doctors nurse relationship, we also have doctors patients relationship. Doctors and patients must work together. Doctors must understand the patient to be able to diagnose the problem of the patient. There are four key things that form the doctor's patient relationship: trust, knowledge, regard, and loyalty. Trust, knowledge, regard, and loyalty. There are also four types: the paternalistic model, the informative model, the interpretative model, and the deliberative model. We also have four types of patients. Patients who want the problem solved, patients who don't ever want to consider surgery at all. If you understand the kind of patient you are dealing with, if doctors and nurses understand the type of patient, there won't be any constraints, there won't be any conflict, or there won't be any problem. Patients who just want to know whether the problem was worsened or is gonna be solved. Patients who just want the problem taken up. Patients who just want to make all the decision. When you be able to understand this, you'll be able to work in unity with your parents. There are 7 C's that guide a quality doctor's nurse relationship. 7 C's. If these 7 C's are looked into, doctors and nurses will have a smooth relationship with their patients, and their patients will be able to get adequate care. The communication, collaboration, conflict resolution, culture, change, control, and competence. I won't be able to explain them in details. And there are definitely importance of a good doctor-patient relationship to increase the patient satisfaction. It will lead to better understanding and to foster better communication. When you have good communication, you'll be able to have a better communication with patients. In conclusion, I would like to say, as the as defined by WHO, the World Health Organization, health is the state of complete physical and social well-being of a person. As medical practitioners, nurses, and doctors, the lives of people are in his hand. We must not take it. We must not hold it anyhow. With we must hold the lives of people with care, and we must not allow our relationship. Doctors and nurses must not have a conflict. Must not be in quarrel when treating a patient. We should work in harmony, and when we work in harmony, we'll be able to meet the same goal, and we'll be able to save life. Thank you.